Imagine this. You've cut yourself in the forest, and the nearest pharmacy is several hours away. Or your whole body aches from the flu in the middle of the night, and you've run out of medicine. In moments like these, our ancestors didn't turn to a pharmacy. They stepped outside, into the garden, the meadow, the roadside. For thousands of years, humanity treated illnesses with what grew underfoot. Soldiers stopped bleeding with leaves. Mothers brought down their children's fevers with herbal tea. Travelers healed wounds with plants picked right beside the trail. And it worked. Not because people were naive, but because nature had created everything necessary long before pharmacies existed. Today, we are returning to that knowledge. Before you are 20 plants that humanity has used for centuries and that modern science is finally beginning to study seriously. Some of them are probably growing right outside your window at this very moment. Number 1. Usnea, a lichen with antibiotic potential. Usnea holds a special place on this list. It is not a plant in the strict sense of the word. It is a lichen, gray-green beards resembling strands of gray hair that hang from tree branches. Its main active compound, usnic acid, demonstrates pronounced antimicrobial activity, including against a number of antibiotic-resistant strains. For centuries, usnea was applied to infected wounds as a natural antiseptic, and today scientists are only confirming what traditional healers have known for a long time. Number 2. Barberry is a plant with a millennia-long history. Barberry has been used in medicine for more than 2,000 years, yet science only became truly interested in it in recent decades. The secret lies in berberine, an alkaloid that has become one of the most extensively studied natural compounds in modern pharmacology. Berberine inhibits the growth of bacteria, fungi, and parasites, reduces inflammation, stimulates bile secretion, and helps normalize blood sugar and cholesterol levels. In an era of growing antibiotic resistance, barberry is experiencing a genuine scientific renaissance, and not without reason. Number 3. Red clover, a meadow pharmacy at your feet. This common meadow flower holds far more than meets the eye. Red clover is rich in isoflavones, plant compounds with a mild estrogen-like effect. Clinical studies confirm its effectiveness for menopausal hot flashes, and in folk medicine, it has long been used for eczema, psoriasis, and chronic skin inflammation. Tea made from its blossoms has a mild, slightly sweet taste. The key to success is consistency. Noticeable effects develop gradually over the course of several weeks or months. Number 4. Sassafras, a lesson in respecting nature. The indigenous peoples of North America highly valued sassafras. Its roots and bark were used to treat fever, rheumatic pain, and digestive disorders. Later, the plant's distinctive spicy aroma found its way into the production of traditional root beer. However, there is a darker side to this story. Sassafras contains safrole, a substance that, in significant amounts, can damage the liver and has carcinogenic potential. Today, its internal use is restricted by the laws of many countries. Sassafras is an instructive example of how traditional knowledge and modern science should complement one another. The former suggests what deserves attention, while the latter defines the boundaries of safety. Number 5. Meadowsweet, the ancestor of aspirin. Meadowsweet, its story perfectly reflects the essence of the conversation about forgotten healing plants. It was this modest meadow plant that inspired chemists to create aspirin. Meadowsweet contains salicylates, the compounds that became the foundation of the famous drug. But here is what is remarkable. Unlike aspirin, meadowsweet does not irritate the stomach lining. Moreover, folk healers used it for centuries both as a pain reliever and as a remedy for stomach inflammation. Tea made from its fragrant flowers is pleasant to drink, light, slightly sweet, with a delicate hint of almond. It was used to help with headaches, joint pain, fever, and digestive discomfort. Meadowsweet reminds us that sometimes the natural original is wiser than the synthetic copy. Number 6. Calendula, the flower born on the battlefield. Long before the advent of antiseptics and modern dressings, medieval warriors carried dried calendula blossoms on their campaigns. This was not a superstitious ritual, but a deliberate choice. The plant genuinely helped prevent wounds from festering and promoted healing even in field conditions. Modern science has fully confirmed this reputation. Clinical trials have shown that calendula extracts can accelerate the healing of burns, cuts, and post-operative wounds. The explanation is simple. The flowers are rich in triterpenoids and flavonoids, compounds that both reduce inflammation and suppress harmful microbes. Making a homemade ointment is easy. Simply infuse the dried flowers in vegetable oil, and you will have a remedy that helped keep soldiers from dying of blood poisoning for centuries. Number 7. Sea buckthorn, a gift of harsh climates. Sea buckthorn survives where most plants would not last a single season, in the rugged mountain regions of the Himalayas and Siberia. Perhaps it is this resilience that endowed it with such powerful healing properties. Tibetan, Russian, and Chinese healers have used it for centuries to restore the skin and mucous membranes, and Soviet cosmonauts even took sea buckthorn oil into space as protection against radiation exposure. What makes the plant unique is its rare omega-7 fatty acid, which literally restores the skin's barrier functions from within. Clinical studies confirm its effectiveness for eczema, dry eye syndrome, and chronic dry skin. Unlike most moisturizers, sea buckthorn does not merely mask the problem, it addresses its underlying cause. Number 8. Comfrey, the plant that stitches the body together. Its traditional nicknames, bone setter and knit bone, speak for themselves, reflecting the high regard in which this plant was held in folk medicine. And that reputation was well earned. Comfrey root contains allantoin, a substance that literally stimulates cell division and promotes the repair of damaged tissues at the cellular level. Modern clinical studies have confirmed its effectiveness for back pain, ankle sprains, and osteoarthritis. However, an important caveat must be made. Comfrey should be used only externally. The pyrrolizidine alkaloids it contains are toxic to the liver if ingested. Use it as an ointment or compress, and it can become one of the best allies for soft tissue injuries. Number 9. Mullein, nature's first aid for the lungs. This tall plant, with its soft, velvety leaves and dense yellow flower spike, is familiar to anyone who has ever walked along a roadside or through an open field. Few people realize, however, that behind its unremarkable appearance lies significant medicinal potential. Mullein leaves are rich in saponins, natural expectorant compounds that help loosen and clear mucus from the respiratory tract. This makes the plant particularly valuable for bronchitis, asthma, and persistent productive coughs. The traditional method of use is simple. A strong tea made from dried leaves, carefully strained through cheesecloth to remove the tiny hairs, was consumed 2 or 3 times a day during colds. Mullein does not merely suppress symptoms, it helps the lungs do their job. Number 10. Plantain, the pharmacy that's always nearby. It is hard to find a plant that is both more widespread and more underrated. Plantain grows literally everywhere, in lawns, along paths, and in cracks in the pavement. Native Americans aptly nicknamed it the white man's footprint. It seemed to spring up wherever European settlers walked. But both settlers and indigenous peoples quickly came to appreciate its healing power. A clinical study conducted in Iran found that a plantain ointment healed second-degree burns more effectively than standard medical treatments. The compounds found in its leaves reduce inflammation, stop minor bleeding, and suppress infection. The method of use is remarkably simple. Chew a fresh leaf or crush it between your fingers and apply it to a cut, burn, or insect bite. Within minutes, pain and swelling begin to subside. Plantain is a pharmacy that follows you everywhere and never closes. Number 11. Vervain, the herb for people who have forgotten how to relax. In old herbal texts, vervain was consistently described as a remedy for a particular type of person. Those who live in constant tension, cannot let go of their thoughts, and only fall asleep at dawn when exhaustion finally takes over. This plant does not suppress the nervous system like pharmaceutical sedatives. Instead, it gently restores balance. Preliminary animal studies suggest a genuine anti-anxiety effect without causing drowsiness or sluggishness. Traditionally, vervain was brewed in the evening to help the body and mind shift gears after a stressful day. Its taste is frankly bitter, so it is commonly sweetened with honey, turning this evening ritual into something both beneficial and enjoyable. Number 12. Elecampane, the patient healer of the lungs. If mullein is first aid for the respiratory tract, elecampane is long-term rehabilitation. It was used when a cough lingered for weeks, bronchitis became chronic, and the lungs struggled to recover after an infection. Elecampane root contains sesquiterpene lactones, compounds with documented antitussive and antimicrobial properties, active even against pathogens responsible for respiratory illnesses. The defining feature of this plant is that it requires time. Elecampane is taken in courses lasting several weeks or even months, gradually strengthening and restoring lung tissue. It does not provide rapid symptom relief. Rather, it offers deep healing for those patient enough to trust nature's rhythm. Number 13. Acmella, a natural anesthetic with instant action. Acmella is one of those plants that leaves a lasting impression. Chew a fresh flower just once, and you will immediately understand why it was called the toothache plant for centuries. Within seconds, an intense tingling spreads through the mouth, quickly followed by complete numbness. This is the effect of spilanthol, a natural local anesthetic whose effectiveness has been confirmed by modern research. Traditional healers used acmella for toothaches, mouth ulcers, and sore throats. The effect lasts up to half an hour, long enough to endure acute pain and address its cause. Acmella does not treat the source of the problem, but it provides something that is sometimes even more important: immediate relief. Number 14. Mahonia, a botanical answer to chronic skin conditions. Mahonia only vaguely resembles a grapevine. In reality, it is a dense, thorny shrub with glossy evergreen leaves and clusters of dark blue berries. Yet it belongs to a rare group of plants backed by substantial clinical evidence. Several independent studies have documented significant improvements in patients with psoriasis and atopic dermatitis who regularly used Mahonia extract. The secret lies in berberine and related alkaloids, which simultaneously suppress inflammation and combat pathogenic microorganisms. The results do not appear overnight. The plant needs time to reveal its effects. But for those who have spent years struggling unsuccessfully with stubborn skin disorders, Mahonia may prove to be the missing piece. Number 15. Horse sorrel, when the skin speaks for the gut. Horse sorrel is a classic example of what traditional herbalists called an alterative, a plant believed to purify the blood by improving the body's elimination and cleansing systems. Its thick root is rich in bitter compounds and anthraquinones that stimulate bile production and enhance digestion. It was commonly used for sluggish bowels, chronic constipation, and persistent skin eruptions that resisted topical treatment. The logic is simple and remains relevant today. The skin often reflects what is happening inside the body. Improve digestion, and many chronic skin problems begin to fade on their own. Horse sorrel works slowly and gently. It does not replace the body's functions, but rather reminds it how to perform them properly. Number 16. Yarrow, the warrior's faithful companion. Among medicinal plants, yarrow occupies a special place because it possesses a remarkably rare combination of properties. It both stops bleeding and accelerates wound healing. For this reason, soldiers from many eras and cultures packed fresh wounds with yarrow right on the battlefield, without waiting for a healer's help. Modern research fully confirms this centuries-old practice. Its hemostatic, anti-inflammatory, and wound-healing properties have been scientifically documented. Yet its usefulness is not limited to external applications. As a tea, it can help reduce fever and soothe digestive upset. It is a plant equally at home in a field medic's kit and a household herbal cabinet. Number 17. Self-heal, the plant that told its own story. When people give a plant names such as self-heal or life-giving self-heal, it is not an exaggeration, but the result of centuries of accumulated experience. The Latin name Prunella vulgaris modestly points to its commonness, but traditional healers valued this unassuming plant with purple flower spikes far more highly than its appearance would suggest. Modern science has identified several valuable mechanisms of action. Self-heal reduces inflammation, promotes tissue repair, and, perhaps most notably, can break down bacterial biofilms, the protective barriers microbes build against antibiotics. Its effects are particularly pronounced on mucous membranes. Regular gargling with a strong tea made from the plant can provide noticeable relief from sore throats or mouth ulcers within the first day. Number 18. Agrimony, the gentle guardian of the throat and gut. Agrimony is one of those herbs that does not produce dramatic, immediate effects, but works reliably and gently, like an experienced old-school healer. Medieval herbalists turned to it whenever throat inflammation or digestive troubles were involved, not out of desperation, but because they genuinely believed in its effectiveness. The basis of agrimony's medicinal properties lies in its tannins, which have a pronounced astringent effect. They effectively tighten and soothe irritated mucous membranes. A strong tea made from the aerial parts of the plant was used as a gargle for pharyngitis, tonsillitis, and laryngitis, while drinking it helped manage mild diarrhea. It is a simple, accessible, and undeservedly forgotten plant. Number 19. White horehound, treating a cough instead of suppressing it. Today, pharmacy shelves are packed with cough remedies, most of which simply suppress the cough reflex. But as recently as the early 20th century, every pharmacy sold horehound lozenges and candies, and this was a deliberate therapeutic choice rather than a marketing gimmick. The plant's primary active compound, marubian, stimulates the bronchial glands, thins mucus, and helps the body expel it. The key difference between horehound and many modern medications is that it does not fight the cough itself. It makes the cough productive, transforming a painful, exhausting hack into an effective cleansing of the airways. That is how genuine treatment should work, not by masking symptoms, but by helping the body finish the job it has already begun. Number 20. Boneset, the forgotten weapon against influenza. In the 19th century, when influenza epidemics devastated entire cities and antiviral drugs were still more than a century away, boneset was found in nearly every household as an essential reserve for illness. It was called upon to treat what was known as break-bone fever, the condition in which every bone seems to ache, the fever refuses to subside, and the body feels heavy as lead. The plant was used as both a fever reducer and an immune stimulant. A hot tea was given at the first signs of illness, the patient was put to bed, and people waited for the body to overcome the infection. The tea is extraordinarily bitter, perhaps among the bitterest in folk medicine. Yet according to traditional herbalists, that very bitterness was proof that the plant was powerful enough to confront a serious illness. Nature created these plants over millions of years. People discovered them, studied them, passed knowledge about them from generation to generation, and protected them as a priceless treasure. In just a few decades of industrial medicine, we somehow manage to forget almost all of it. But the knowledge never disappeared. It waited. In old herbals, in folk traditions, in scientific papers that have finally begun to confirm what grandmothers knew intuitively. Now it is back in your hands. If this material has made you look at roadside weeds differently, give it a like. If you'd like to receive collections like this regularly, subscribe to the channel and click the notification bell. Every week, we publish new content about natural health, medicinal plants, and the wisdom worth bringing back into our lives. And write in the comments, which of the 20 plants surprised you the most? I read every response.